Senora Lopez is a 28-year-old woman who immigrated from Mexico 3 years ago. She hasn't seen a doctor in 8 years. She heard about Haven from one of her friends and called to make an appointment. She is scheduled for a new patient visit at 9 a.m. on Saturday. She arrives at our clinic on time and walks to the front desk where she encounters patient services.
Hola. Hola, buenos días. Bienvenidos a la clínica. ¿Tiene una cita hoy?
Sí, gracias. Me llamo Soledad López y tengo una cita a las 8:30.
Ok, muy bien. ¿Y cuál es su fecha de nacimiento?
Sí, es el 6 de mayo de 1984.
Perfecto. Por favor, tome asiento y el equipo va a llamarle.
Ok, gracias.
Patient services construct a new medical chart for Senora Lopez and let the session coordinator know that she has arrived. The team see that their 9 o'clock patient has arrived and check in with the session coordinator to ask for the chart.
Hey Janine, I saw that my 9 a.m. patient is here. Do you have a chart?
Good timing. Here it is.
Great, we'll go ahead and get started.
So Senora Lopez is sitting in the waiting room when her name is called out by a JCTM.
Hi, Senora Lopez. My name is Anton. I will be the junior clinical team member taking care of you today.
No entiendo.
And that's why we're so happy to have the amazing interpreters at Haven.
My name is Lucy and I'm the Interpreting and Diversity Director. We at Haven have many wonderful interpreters. They are comprised of both graduate and undergraduate, fluent or native speakers. They interpret for all our Spanish-speaking patients. An interpreter at Haven greets the patient from the time that they are called for their clinical appointment and stays with them until the end of the medical visit. Interpreters also work with patients in the Education and Social Services Department, depending on the preference and the needs of the clinic. In addition, our interpreters are called upon to help in the translation of a variety of health-related documents distributed to our patients. An interpreter must be sure to allow time for introductions, maintain eye contact and appropriate body orientation, and address the patient directly.
Let's see how that should have been done.
Hi, Senora Lopez. My name is Anton. I'm a medical student and I'm a member of the clinical team that will be taking care of you today.
Y yo soy Salvador Fernández, yo voy a ser su intérprete hoy. Él es Anton, él es parte del equipo médico y es un estudiante que te va a ayudar hoy.
Muy bien, gracias. Mucho gusto.
Very well, thank you. Nice to meet you.
Senora Lopez, come this way, please.
Ven con nosotros, por favor.
The JCTM and interpreter walk the patient back to the triage area.
Please have a seat.
Siéntese, por favor.
Okay.
Once in the triage area, the JCTM collects the vital signs, including the height and the weight. The JCTM should avoid eliciting the chief complaint in the triage area. This can be done in the room.
Senora Lopez, could you please follow me to the room now?
Señora López, ¿nos puede seguir al cuarto ahora?
Please have a seat, Senora Lopez.
Por favor, siéntese, por favor.
Now, the JCTM can elicit the chief complaint.
Senora Lopez, what brings you into the clinic today?
Señora López, ¿qué le trae a la clínica hoy?
Es que tenía un dolor de pecho y fui al curandero hace algunos meses, pero ahora me siento un poco mejor y me preocupan algunas otras cositas que quiero platicar con usted.
I had some chest pain a few months ago, so I went to see a curandero, and now I feel a little bit better. Except there are also some other small things that are bothering me that I'd like to talk to you about.
Thank you very much, Senora Lopez. We'll go speak to the senior student and be back very shortly.
Está bien, señora López. Ahorita le daremos al estudiante más avanzado y regresaremos en un poco.
Bueno.
Interpreters also act as a cultural liaison for the team.
Hey, listen, so what's a curandero?
So a curandero is like a traditional healer.
The JCTM now heads off to report to the SETM.
Senora Lopez is a 28-year-old woman coming into the clinic today for some chest pain she's been having the past few months and some other things she's wanted to discuss. She also has visited a traditional healer just recently, and I just took her vital signs and they all appear normal.
Great, let's go see her.
Once the JCTM is reported to the SCTM, the team head back to visit with Senora Lopez.
Hi, Ms. Lopez. My name is Jennie and I'm a fourth-year medical student.
Hola, señora López. Soy Jennie Duffy. Soy un estudiante de cuarto año de medicina.
The SCTM conducts a problem-focused visit. As the SCTM is going through the visit, she is sure to utilize the interpreter correctly, speaking to the patient directly and allowing time for interpretation.
Okay, Ms. Lopez, that's pretty much all of the questions I have. At this point, I want to do a brief physical exam before we go talk to the doctor.
Ok, señora López, esas son todas las preguntas que tengo. Y ahora vamos a hacer un examen físico breve antes de que vamos a hablar con el doctor.
Okay, bueno. So Haven has a lot of services that we can offer to our patients. While we go consult with the doctor, someone from our social services department can come into the room to tell you about these services and see if any of them are of interest to you.
Aquí en la clínica tenemos varios servicios que ofrecemos a los pacientes. Entonces, mientras nosotros vamos a consultar con el doctor, alguien del Departamento de Servicios Sociales va a venir para describir estos servicios y para ver si le interesan.
Sí, me interesan mucho.
Okay, Ms. Lopez, can you have a seat on the exam table and we'll begin the physical exam?
Ok, señora López, se puede subir ya a la mesa de examinación y empezaremos el examen físico.
Okay.
Before the physical exam begins, the JCTM makes a call to social services to make best use of sandwich time.
Social Services, Mika speaking.
Hi, Social Services. This is Anton in room 84. We have a new patient here who wishes to complete an intake form.
What's the new patient's name and her date of birth?
Yeah, Senora Lopez, and her birthday is May 6th, 1984. We're just finishing up our physical exam, so if you could come by in about 5 minutes, that'd be awesome.
Great, we'll see you in about 5 minutes. Thank you.
Okay, Senora Lopez. First I'm going to listen to your heart and lungs and then we'll check your belly.
Ok, señora López, primero vamos a examinar sus pulmones y su corazón y después vamos a examinar su panza.
Ok, muy bien.
Breathe in and out deeply with your mouth open, please. Ms. Lopez, is it okay if Anton takes a listen to your heart and lungs as well?
Ok, señora López, ¿está bien si Anton también escucha su corazón?
Sí, está bien.
The physical exam is a great time to practice teaching the preclinical student. When teaching is occurring between team members, be sure that the patient is aware that the conversation is about teaching. Once the physical exam has finished, the team leave to present to the attending. At this point, sandwich time can begin. As planned, social services arrive promptly to make the most of sandwich time.
Hi, Senora Lopez. My name's Mika. I'm from the Department of Social Services. I'm just going to ask you a few questions today.
Hola, señora López, soy Mika, soy del Departamento de Servicios Sociales y nomás tengo algunas preguntas para usted.
Ok, bueno.
Social services can screen for many different needs. They use a screening form that should be used at every opportunity. Social services made a referral and a follow-up and noted it correctly on the patient tracker form.
Okay, Senora Lopez, it was really great meeting you today, so I hope the rest of your visit goes well.
Bueno, señora López, fue un placer conocerla hoy y ojalá que el resto de su visita esté bien.
Bueno, muchas gracias. Mil de gracias por su ayuda.
Whilst the social services department is visiting with Senora Lopez, the clinical team are presenting to the attending.
Hi.
This is a patient who's a 28-year-old female who comes in with chest pain. She says that it's been going on for a couple of months and describes it as sort of a burning pain.
Before the clinical team presents to the attending, they should try and have all of the forms ready that require provider's signature. This includes lab forms, referral forms, and prescriptions. Having a blank copy on hand prior to beginning the discussion with the attending will maximize efficiency. Sometimes, clinical teams may have to wait to speak with an attending. This waiting time is a great opportunity for the SCTM to teach the JCTM, discuss the differential diagnoses, and work together to come up with a proposed treatment plan.
Okay, great. That was a great presentation. What is your differential diagnosis for the patient, and what do you think is the most likely diagnosis?
With a patient this age, I think of chest pain coming from kind of one of three different possibilities. One would be like cardiac, the other would be gastrointestinal, and the third would be kind of musculoskeletal. Given how young she is and the fact that she describes the pain as kind of a burning, I worry more about like an ulcer or GERD or something of that nature, as opposed to something cardiovascular like a heart attack or something musculoskeletal like costochondritis.
I agree, that sounds great. Okay, let's go see the patient.
Social services are waiting to report their screening to the entire medical team.
So it went great. She's going to see Women's Health Department after her visit.
Okay, great.
Social services then reports to the Women's Health Department to let them know about the positive screen.
Okay, so we have a new patient. She's screened positive for contraceptive and family counseling. The clinical team is just finishing up with her, so they'll give you a call when she's ready.
Okay, great. Thanks.
Meanwhile, the entire clinical team head back in to finish the medical visit with Senora Lopez.
Hi, I'm Dr. Chatterjee. I'm the supervising doctor on the team.
Hola, soy el Dr. Chatterjee. Soy el doctor supervisor del equipo.
Bueno.
So the student team has been telling me that you've been having some chest pain. Now, is that chest pain a burning pain? Is that correct?
Entonces los estudiantes me dijeron que usted tiene un dolor en el pecho, que es como que se está quemando. ¿Es cierto?
Sí, es la verdad.
Yes, that's right.
The attending ensures that all of the important points have been covered with the patient and informs the patient of their likely diagnosis.
So based on what you've told us, we think you have something called acid reflux.
Según los estudiantes, suena como que usted tiene acidez.
With acid reflux, after eating certain foods, acid from the stomach can come up to the chest and cause a burning pain.
Con la acidez, después de comer ciertas comidas, sube el ácido y siente como un dolor que quema.
Ah, okay.
Now the team is going to talk to you a little bit more about acid reflux and tell you what you can do to feel better.
El equipo le dirá más sobre la acidez y qué es lo que puede hacer para sentirse mejor.
Ok, perfecto.
Perfect.
It was very nice to meet you. I hope you feel better.
Un gusto conocerte. Ojalá que se sienta mejor.
Gracias.
Thank you.
At this point, the JCTM gives the Women's Health Department a 5-minute heads up.
Women's Health Department, Amanda speaking.
And this is Anton in room 84. We have a patient, Senora Lopez, interested in contraceptive counseling.
Okay, I'll meet you outside the room in 5 minutes.
The team now explain the plan to Senora Lopez.
The first part of the plan involves changing your diet a little bit to eat fewer foods that can cause acid.
La primera parte del plan es evitar las comidas que causan acidez.
In addition, we want to give you a medication that will cause your stomach to produce less acid so that you don't get as many symptoms.
Y también le daremos una receta para una medicina que causa que su estómago haga menos ácido y evita los síntomas.
And the final thing is, before you leave at the end of today, we want to check some blood tests.
Y finalmente, antes de que usted se vaya, queremos hacer unos exámenes de sangre.
Ok, bien.
Okay, Senora Lopez, do you have any questions about the plan?
Okay, señora López, ¿tiene algunas preguntas sobre el plan?
No, ninguna.
No, none.
Okay, great. Well, we'll step out and get your prescription ready, and Women's Health Department will be in shortly.
Y bueno, saldremos para arreglar la receta y vendrá el Departamento de Salud de Mujeres en un poco.
Perfecto, gracias.
Perfect, thanks.
The SCTM makes note of any follow-up or referral on the patient tracker form. Just as planned, the Women's Health Department is ready to begin their visit.
So Anton and I are going to go get the patient's prescriptions ready. While we do that, you and Salvador can go in and conduct your visit. After you're done, the patient needs to get her labs drawn, so go ahead and call the lab and they'll come in and do the draw from within the room.
Okay, great. Hello, I'm Amanda. I'm from the Women's Health Department.
Hola, soy Amanda, soy del Departamento de Salud de Mujeres.
Mucho gusto.
Nice to meet you.
Okay, Senora Lopez, is there an option that you're particularly interested in or would like to know more about?
Señor López, ¿hay una opción en particular en que usted quiere saber más o está interesada?
Sí, me gustaría hablar de esta opción, la T.
Yes, I'd like to know more about this option, the T.
The Women's Health Department discussed contraceptive options with Senora Lopez, helping her navigate the options and to find an option that suits her best.
Senora Lopez, it was really great meeting you today, and we'll be in touch with you about the IUD when it's ready.
Bueno, señora López, fue un gusto conocerla y le contactaremos cuando esté listo el dispositivo.
Bueno, gracias.
Oh, thank you.
Women's Health is sure to make note of the referral or follow-up on the patient tracker form. And, as planned, Women's Health then heads back to their office and lets Lab know that Senora Lopez is ready.
Hi, Lab. This is the Women's Health Department. The patient is ready for you in room 84.
Okay, great. We'll be right there.
Once Lab has collected their equipment, they head to the room to see Senora Lopez.
Hi, I'm Caitlin. I'm from Lab, and I'll be taking your blood today.
Hola, pues soy Caitlin, soy del laboratorio y le voy a sacar la sangre hoy.
Okay.
Lab is sure to get 2 patient identifiers and reassure the patient. Interpretation is very important in relieving any anxiety that the patient may have.
Okay, Senora Lopez, we're all done here. Have a good day.
Ok, señora López, ya hemos terminado. Tenga un buen día.
Bueno, gracias.
So the clinical team has written the prescription and returned to the room to wrap up with Senora Lopez.
Hi, Ms. Lopez. How was everything?
Hola, señora López, ¿cómo fue todo?
Muy bien, perfecto.
That was fine. Perfect.
Wonderful. Well, here's the prescription we talked about. And if you'll come with us, we'll go make your follow-up appointment.
Qué bien. Y aquí está la receta que le contamos. Si viene con nosotros, ahora haremos la cita para regresar.
Okay.
The team then accompanies Senora Lopez to reception, where they make any follow-up appointments that have been noted on the patient tracker form.
Aquí es la tarjeta para recordarle de su cita.
Perfecto, gracias.
De nada.
Senor Lopez, it was very nice to meet you. Hope you have a great day.
Señora López, fue mucho gusto en conocerla. Que tenga un buen día.
Gracias a usted también.
Hey, Janine. We finished up with our first patient. Do you have another one for us?
Yeah, we definitely do. Here you go.
Great. Thanks so much.
Check this out.